Greetings, everyone, and welcome to Beyond Connections, rural Georgia's premier medical and health professional radio network. This is MedTech. I'm your host, Frank Baia. Today's guest, we're greeting Matt Jansen, Executive Director, Georgia Partnership for TeleHealth. Matt, welcome to the program.
Thanks, Frank.
Well, pretty exciting time. I think I know that you've been in the vineyard a long time being an evangelist for this kind of outreach technology. I think I'd want to jump into it because I think there's a lot of people that maybe have a little confusion or a little bit of a misunderstanding between telehealth and telemedicine. But let's talk for a second about, I think, a pretty exciting event that's going on in real time, and that is, we are focused on rural outreach throughout the state of Georgia as far as getting health care into the rural marketplace. And I know that you're involved in taking that to probably an extreme because you're involved with now connecting us to China. Why don't you tell us a little bit about that?
Well, yeah, we've had some really interesting opportunities over the past couple months as we've been able to kind of basically put together a platform that's very portable, very integratable across platforms, across different devices. So really the idea that has really started to latch on or catch on in the environment or the telemedicine, telehealth environment is going overseas. There's a lot of physicians, there are a lot of groups that are interested in doing work on an ongoing basis because right now you have a problem with a lot of groups that go into, say, from a med school environment or from like, say, a residency program. They go overseas for like a 2-week period, and they come back. They never really get to follow up with their patients. So we started to talk to a lot of groups about this, and there's actually a physician over at Northside Hospital here in Atlanta that is a geneticist, and by the name of Dr. Troyer, and she's going over there as part of a mission group to connect with an orphanage and basically provide ongoing support for some of the genetics cases that are presented or some of the ongoing needs of the kids that they go over and meet with yearly. So it's an exciting time. A couple other things, we're going to Guatemala next month and working with a group out of LSU as well to connect with another orphanage in Guatemala. So really the platform and the network capacity of what we have in Georgia is being spread across the planet right now. It's really exciting.
It truly is a proof of concept when you have no limitations to the extent that literally going around the entire world and dealing in something as remote as China, or one would assume as remote as China, and yet you're able to provide that connection and provide that kind of expertise. Tell us a little bit briefly about the Georgia telemedicine or telehealth partners.
Well, the way Georgia Partnership for TeleHealth was initiated was really crucial in how it's really springboarded into where we are today. So it was really developed from the front end as an integrated platform. So you didn't just have one hospital system, one university system, one set of, say, specialists. It was really designed to integrate all disciplines of healthcare. So you have everything from a telehealth perspective, which is more healthcare education, more prevention layers to providing healthcare, but then you go into the full-on application of a diagnosis or a consult to diagnosis of a patient via an online or video conferencing platform with all of the peripherals needed to be available in order to make that diagnosis happen, and that's more the telemedicine side. So really we've been able to take it from a telehealth platform, which was kind of the original concept behind accessing remote areas and providing with education. But now we're actually able to diagnose and treat, and that's where the telemedicine side of Georgia Partnership has really started to take off. And the state of Georgia has been very, very progressive in its ability to bring this into some of the different environments, whether it's an ICU unit at a rural hospital or even into a community behavioral health center or, primary care practice. We are now starting to access schools. We'll have over 40 schools in our network by the end of the year. So we have some non-traditional clinics that are also starting to get a foothold in providing access to a lot of people who have had literally no access previously.
We're speaking with Matt Jansen, Executive Director of the Georgia Partnership for TeleHealth. Let's go a little bit deeper in terms of talking about Georgia and the rural marketplace. Obviously, one could only begin to assume the benefits, even from the standpoint not only of a healthier community, but literally a healthier economy, because good health care and good health care services is part of the proactive economic development of a lot of these remote areas in terms of attracting industry into their marketplaces. But maybe go a little bit deeper about how do you see telemedicine specifically helping rural Georgia?
Well, we're actually not only from a recruiting standpoint. When an organization or a business looks at an area, they look at several different factors. One of them is healthcare. How healthy are the employees that they're going to be able to provide a job for going to be? And then they also look at education and a couple other economic factors in relation to the type of business that they're going to be doing in that region. So we're also working with employers. This health and wellness movement within the employer environment, especially employers that are self-insuring their employees today. This is a very good opportunity for them to provide, critical access to, say, chronic care illnesses like COPD, diabetes, and some of the others, even sleep apnea. We have a lot of remote, plants that are in the timber industry, and they're truck drivers. These truck drivers have, some of them have different chronic illnesses, and they have to be monitored regularly. So this is a way for employers to actually connect with specialists at the plant, so they don't have to drive 6-7 hours round trip to Atlanta from, say, Willacoochee, Georgia. They can actually connect from their home office. And, this is cutting down a tremendous barrier in providing the necessary types of intervention and health care needed to manage high-level chronic illnesses like, hypertension and diabetes and some of these other things that really, in Georgia, are some of our high-risk areas in some of these remote areas, and even in our urban areas where there are plenty of resources. There's still a lot of need for coordinated care, and that's where telemedicine really fits into some of the solutions that are needed to overcome some of the barriers of our healthcare costs and bringing them to a more efficient, more effective platform for patients to access.
Talk a little bit about the environment in terms of the culture as it relates to the industry, in terms of accepting technological advancements. Obviously, I think when anyone thinks about healthcare, we certainly know that the procedures and things like surgical capabilities have literally gone futuristic in terms of lasers and all kinds of new tools and new applications. I guess where I'm going is, do you get a lot of resistance to change? What's the feeling as it relates to the adoption of this kind of technology, both from the provider and from the patient?
Yeah, this is a few years ago we were wondering if online banking was going to take hold. Now we're taking pictures of checks and sending them to our bank accounts. Health information, health care, having access to a physician that is very specialized is a kind of a luxury that not a lot of people have in today's market. And also the providers, the training that went into the residency programs of a lot of our medical schools across the country, not just in Georgia, really didn't incorporate this layer of technology or this level of modality within the training of the physician. So, when you're coming into an industry, and healthcare is a very specific and it's very precise in how they want to treat certain types of elements. So when you add a new layer, or you add a new kind of connectivity between patient and physician that's a little different than the way someone was trained, there's always going to be a little resistance. The early adopters, this has been around, and since remote medicine has been around for a long time. The military's been doing it for decades. Telemedicine itself has been around in its current state only about 30 years. Since the creation of the internet, it started to really take a foothold. We were doing closed circuit surgeries, when the television was invented. So the remote access is not something new. Now bring it into mainstream, in a mainstream environment where people are doing it very regularly, and you create a system of care that allows patients to tap into this, and you allow physicians to maximize their practice and make it more efficient and more effective, and then connect it to healthcare information technology and outcome measuring so that we can be more specific on what's working, what's not working. That's the recipe that I feel technology brings to the table. Now, technology has kind of outpaced the healthcare industry a little bit. I think that's what we're seeing. We're seeing, a slow adoption in electronic medical records and some of these other areas because there are so many systems of change that have to happen in workflows and processing a patient and the information so that you meet the regulations and you keep the standards of healthcare really, really high. You don't want to degrade the level of healthcare provided just because you have a new technology. So I believe in GPT, and what we believe is creating a really high-level health-grade environment for conducting a consultation, everything from the type of technology that you use or a type of equipment you use to the type of providers you use, and then also the training that goes on behind the scenes with those nurse practitioners, those PAs, those physicians. They have to know how to utilize this environment based on their training. So we can't put something in front of them that doesn't adhere to the way they were trained. Mm-hmm. So I think that's where we are in the adoption. There's more and more people doing this, so it's easier for them to conceptualize and actually put it into practice.
Well, let's talk a little bit more about the adoption. Obviously, you've got situations where there are areas that are not really covered as of yet. How do you educate? How do you motivate? What's the best way to expand telemedicine into those areas?
Right now we were really focused and have been really focused on kind of the provider side. Really talking with the specialists, really working with the the providers out there, psychiatrists to PAs to nurse practitioners, CEOs of hospitals, big administrative firms, really trying to, and policymakers also, giving them the information so that they can build policy and create a system that can support this level of integration. But also, we need to really focus on the consumer area or the patient side, the people side of this equation, because that's where I think the education has to go now. I think that's where our prime focus needs to be, is educating people, just in rural areas and urban areas on how they can better access different types of specialties. And I feel that will really help the physicians make better decisions. These outlying clinics, they will become more attuned based on their consumers. I mean, it's that's the beauty behind of the United States. We're developed around a free market, so the consumers need to be able to make a choice, but a guided choice, and you want to make sure that it's safe and secure for the patient. I mean, that is at the forefront of every discussion I have with every vendor that we bring in the network or even provider. So if we're using specific types of equipment that's not encrypted properly, then we don't use it. If it's a provider that doesn't want to use the certain levels of security, then we don't use that provider. We don't allow that provider to practice. The same for our presenting sites. If the hospital doesn't want to adhere to our security and our network configuration, then they can't be in network. That's the idea behind providing a very high-level medical-grade solution in a very efficient way. And Georgia Partnership for Telemedicine is a nonprofit organization. That was another really key factor in bringing in a lot of these pilot studies and funding things that helped us to get our models built around certain ways to apply and implement telemedicine and telehealth in these real remote areas, because some of this equipment and some of these platform-based solutions are very expensive. Now that technology is finally starting to recognize this, and some of the big companies are starting to recognize this, the technology is getting cheaper and sleeker and more inoperable. And that's what we've really been, this is the environment that we thrive in, because now we can make it happen everywhere from a full-fledged telemedicine cart all the way down to an iPad, and an iPhone, or your basic handheld, smartphones that we can actually connect with through our network in a very secure manner. So the technology is not really the problem. We really need to get the consumers educated now and bring the provider and consumers together, so that patient and physician interaction is seamless and the technology fades away. That doesn't need to be the barrier, and it's really not. It's just about getting people to basically log in.
Well, it's pretty, they say it's an economy of attention, that there's so much information out there that it's difficult to get heard in all of the noise. So I can see the challenge that you've got with all of the opportunity and the success that you're enjoying. The challenge is still a level of messaging and communication, as you point out, getting those people to pay attention and to understand what's available to them, both as a provider and as a patient. Before we go, and we're quickly running out of time, any last thoughts on the future? Tell us a little bit about your perspective, if you can dare go out, say, several years from now. What does telemedicine and telehealth look like in Georgia?
The platforms and the integration of healthcare information and technology is really moving into the home. I feel, we do a lot of home monitoring already, which is considered telehealth and telemedicine. The word tele, I think, will go away, and this will be a standard of care for a large percent of our chronically ill patients across the country and across the world. I think, we're going to have to, our healthcare system is changing rapidly, and there's a lot of uncertainty. Is telemedicine the final solution to making this all make sense? I don't think that's the silver bullet. I think we really have to look at a coordinated care effort, and we're going to have to break down some of the silos that we've created over the years in relation to how we treat patients that walk in the door, or possibly treat patients that don't need to walk in the door, and get there before then, and empower the patient to take charge and be a part of their health information record and their health care practice, and as the basic underlying communication tool for them, so they can become better consumers. Because right now we have a healthcare customer market. When you're trying to build a consumer market, you have to build a way for the consumers to communicate with that market. We have one of the only systems in the world, or even from a business perspective in healthcare, that you don't know exactly what you're getting when you walk in the door. You don't know what you're paying for. You don't know how much the costs are going to be when you walk in the door, because there's so many different layers to it. We need to become better. We need to become better at educating the consumers, and also the healthcare industry itself has to become more standardized. And you don't want to take away the tools from the providers that they need to make an educated decision. We've done this, and we've actually did this in education as well. We created an environment where teachers have to, educate children, but utilize very rudimentary tools in doing so. So we need to empower the same sort of environment that in healthcare as we do in education, and in some other areas that I feel could really be beneficial in the future, and help lead to a better healthcare consumer-based market where I'm making the decisions and I'm the center of my healthcare. Right now, it's just the opposite. There's some other underlying controls that are in the center of how my treatment is delivered, and it really needs to be patient-driven, physician-supported, and administratively facilitated. So you can have kind of that holistic approach to providing care to no matter where you are in the world.
Obviously, hearing you speak and listening to some of the information that you provided our listeners today, I'm thinking it doesn't matter whether it's China or Chatsworth. Telemedicine, telehealth is here now, and it's going to be here in the future, and probably the defining, technological advancement of the health care industry for the next decade or so. Matt, thank you so much for you obviously are running like crazy and got a busy schedule on a number of different levels, but you took the time to spend a few minutes with us today on MedTech Radio. Thank you for joining us.
Thanks, Frank. I appreciate you all doing this in Global Speak and everybody getting together. This is how we're going to keep moving the mission forward.